Greetings. I am Kim Youngjae, the director of the Korea Dental Hospital. I have been running a dental hospital in Ansan, Korea for about 30 years, and after trying various things, I developed and I'm using the AllonX implant. And I have been giving lectures on implant treatment until now. Actually, I am also very interested in dental occlusion, so I have been giving lectures on occlusion for a long time. Also, the senior dentist I learned from taught me well about the dental laboratory process. So I talk and share opinions with not only many dentists but also dental technicians, and I am studying like this. Now I will begin the lecture about AllonX. I am currently the director of the Korea Dental Hospital, and I am studying with many dentists by forming the Korea Occlusion Research Association. And I graduated from Cheonam National University College of Dentistry and Graduate School, and I'm an oral surgeon. I have written 5 books on the diagnosis and treatment of edentulous patients, implant occlusion, TMD, and full mouth reconstruction. I'm currently preparing to publish a book on occlusal adjustment. What was difficult for me while studying was no one told me what to study. So, if I want to maintain a minimum level of dignity as a dentist, I need accurate knowledge and skills. Or, if I want to be better than others, I need to study the necessary knowledge and learn some skills myself. But there was someone who taught me what that was. So I traveled around a lot and met a good senior and studied with him. So I learned a lot from there. And I also learned from many famous teachers. I think I learned a lot of things that I could learn here and there in Korea. But I'm from the new generation. I'm from the old generation now, but back then it was the new generation. And I majored in oral surgery. So I thought it would be good to acquire some techniques or knowledge that fit my style better, so I organized what I learned. I've written several books and studied hard, and that's what I'm doing. It's the same now. Actually, I want to study hard, I want to get better at something, and I still have a lot of desire to study, that's all. The topic of the lecture is AllonX, which seems to be a hot issue in the dental world these days. There's a lot of talk about AllonX these days, and there's a lot of curiosity about what it is. So today, I'll tell you about my clinical experience and insights as simply as possible. I don't want to make the lecture difficult. Even if I make it difficult, it won't be of much use if they don't understand. I want to try to give a lecture while talking in an easy way. So I'm going to talk about AllonX today. Simply put, AllonX implant treatment is a fixed complete denture. That means that a full denture will be fixed to the implant. So, I will talk about it based on full mouth reconstruction and complete denture treatment. Actually, I learned that AllonX is called fully bony anchored prosthesis. So, Novel Biocare's brandmark implant. AllonX is the fixed complete denture treatment developed by Novel Biocare. There were some people who lectured about fully bony anchored prosthesis 30 years ago. In Korea, we didn't think about doing full mouth implants, and lecturers from abroad lectured about AllonX, which is currently being talked about, using a multi-unit abutment called aesthetic cone. And you said that fully bony anchored prosthesis is the final stage of treatment in the dental field or the implant field. It's the same. In a way, it's full mouth rehabilitation. Ultimately, AllonX is full mouth rehabilitation, right? And AllonX is a bit different from any dental treatment we've had so far. So there's a displacement of the mandible due to the change in the vertical dimension. And you have to think about the centric concept. Centric relation, centric occlusion, you learned a lot, right? Then there's centric position, and there are many other stories. But suddenly, since we need those kinds of thoughts, how do we do full mouth rehabilitation? You're thinking like this. Actually, AllonX or fully bony anchored prosthesis isn't technically difficult. But it seems like it was a bit difficult because it requires some kind of mathematical, philosophical concept that goes beyond what we previously thought in terms of knowledge. So we can think about it like this. Where did the AllonX concept come from? But this is originally called a bone-anchored prosthesis. So the prosthesis is fixed to the bone. We only talk about dental prosthetics, but that's not what a general prosthesis means. A prosthesis is a prosthesis or an artificial structure. Novel Biocare did this at first. Novel Biocare did a lot of bone-anchored prostheses. If you look, they put an implant in the bone around the missing ear, and then they made an ear prosthesis. Even then, it was amazing. So, when I think about it now, it has a lot of meaning. This is a prosthesis. When there's war, there are a lot of people who have their legs amputated. In particular, there are patients who have their legs amputated by landmine explosions. In the Vietnam War, there were a lot of people who had their legs amputated by landmines. And in order to rehabilitate those people, they put an implant in the femur, and then they make a fixed prosthesis. Until now, the prosthetic legs we think of are just removable prostheses that fit on amputated legs. What do we call them? Removable prosthesis, right? It's a removable prosthetic leg that you can take off and put back on. But that's uncomfortable, and there are functional limitations. So what orthopedics came up with is the same thing as a dental implant. Ultimately, orthopedic implants evolved from dental implants. It's the same story as how general anesthesia was developed by dentists. Ultimately, an orthopedic implant is implanted into the femur, and when this is osseointegrated, then a prosthetic limb is fixed to it to create a fixed appliance or fixed prosthesis. That's how the function and convenience are increased. This type of rehabilitation treatment is called a bone-anchored prosthesis. So you can't help but wonder where the AllonX concept that dentists are using now came from. At first I also called it fully bony anchored prosthesis, so AllonX was called that. So I wondered who came up with this word, and it was a word created by dentists, and it seems that orthopedics, or medicine, used a similar term. In other words, the bone-anchored prosthesis used in orthopedics has the same meaning as the fully bone-anchored prosthesis used in dentistry. And there is also the expression osseointegration. That's right. It is a word that means the connection between the bone and the implant. The implant that is placed must be osseointegrated with the bone. Orthopedic implants are also placed in the bone to create a prosthesis. This is how a bone-anchored prosthesis is made. After trimming the cut part of the leg and placing the implant, once it is fixed to the bone, the prosthesis is then connected. For that to happen, the placed implant must be attached to the bone. There must be osseointegration. So, in a bone-anchored prosthesis, the word osseointegration was used, but it is originally a dental word. I said it was a wrong expression because it was not a word originally in the medical dictionary. No, it seems like the dental word was simply borrowed as an orthopedic word. Actually, using an osseointegrated implant, a prosthetic leg is fixedly attached to the leg. What is the advantage? You can run with a prosthetic leg. Ultimately, the advantages of a fixed prosthetic leg are function and convenience. Have you seen this? It's in the movie too. It's in the movie called Kingsman. If you look, there's a guy with a prosthetic leg, a spring prosthetic leg. And there was a guy who ran with it. And he even attached a knife to it and killed people. So, the reason we can imagine that is because it actually exists. The reason I got a lot of ideas from the femoral implant is, if you look here, there is a part that connects the prosthesis and the femoral implant. In dental implants, it's called an abutment connection, and in orthopedic implants, it's called a percutaneous post. How can I make this last long without breaking down? Ultimately, it's not screw fixed, it's locking taper fixed. What happens if the percutaneous post connection that's fixed to the femoral implant breaks? You have to pull out the femoral implant. That's a very serious problem. So how can I connect the prosthesis to the implant so that it can last for decades? The connection between the implant fixed to the femur and the percutaneous post is a wedge connection. That's why the lock implant, I used the wedge method for the abutment connection. That's why it lasts so long. If you think about it, there's one implant per leg. What happens if one breaks? For this person, they're all broken, right? In dentistry, they place multiple implants. If one or two breaks, it's manageable. But with femoral implants, that's not possible. And the connection from the percutaneous post to the implant is a screw joint. So the most important part is the locking taper connection, and then the implant side is connected with screw fixation. I also adopted this concept for the slock abutment connection. I don't think there was any other way to stably maintain the function of implant treatment. I wish there was a better way, but there was no better way than this. At first, femoral implants were made of cobalt chromium molybdenum. So the failure rate was high, right? As a cobalt chromium molybdenum alloy. Then, they were made of titanium to increase the success rate. What were dental implants made of at first? They were made of seashells shaped like teeth and embedded in the bone. In ancient Egypt, seashells were implanted in the area where lower incisors were lost. That is, when an incisor tooth fell out, a seashell was shaped like a tooth and embedded. Various implant treatments were attempted in modern times, including implants made of gold or silver, and then, there was something developed in Germany that made an implant out of ceramic and implanted it. But all of them are weak materials, right? And metal rusts. Rust means it's not an inert material. So, because of that rust, the part that attaches to the bone separates. So, if you think about titanium, an oxide film forms on the surface. But that part doesn't change. That's why it's called an inert material. A material that doesn't oxidize continuously and maintains its composition is called an inert material. Metals that don't rust are called rustless materials, and they include metals like stainless steel and titanium. Titanium in particular is a metal that is advantageous for osseointegration because it does not rust, and the surface oxide film that is formed once is maintained. Ultimately, it seems that almost all implants have been changed to titanium. So, in the end, the concept of all implant treatment is the same. Medical and dentistry are moving in the same direction. And the person is the same. Well, the results will be the same. There isn't much of a difference. It's the number of implants and the difference in the load applied to the implants. If you think of orthopedic implants in terms of the AllonX concept, they are one-on-one. In other words, one implant is implanted in each leg to make one fixed prosthetic limb. Ultimately, if one implant fails, everything fails. So, I think it would be helpful to think about this when doing implant treatment. And let's find out one more thing that is similar between dental implants and orthopedic implants. The connection between the femoral implant and the percutaneous post comes into contact with the muscles and skin of the severed femur. This is called the stoma. Ultimately, the periimplantal apparatus with a biologic width in the abutment connection of dental implants and the stoma are similar concepts. But if excessive load is applied to the implant, the surrounding bone seems to be destroyed, and inflammation keeps occurring in the muscles and soft tissues. That is similar to periimplantitis that occurs in dental implants. Stoma inflammation and periimplantitis are the same concept. This is a symptom. The biggest advantage of this bone-anchored prosthesis is that you can shower while standing. That's an advantage that can be easily felt. But you have to clean the stoma area 3 times a day, so you keep it clean in a similar way as you brush your teeth. It's the same as keeping dental implants clean. I personally find it interesting. It's amazing how similar dental implant and orthopedic implant treatments are. Ultimately, the terms used are similar, and the treatment concepts are all the same. And these are the same. If there is enough bone, if you put in a small implant fixture, it will easily fall out. And cancellous bone anchorage is weak. So, it's better to get cortical bone anchorage and then do fixture installation. That would be good. Then, the diameter and length of the implant would be determined according to the femoral size. What happens if you implant a short one? It would fall out easily. You have to implant it as deep and long as possible. I don't know how a femoral implant is so similar to a dental implant, but it's a bit surprising to me. So now, my thoughts on dental implants are similar. Ultimately, a bone-anchored prosthesis is a fixed appliance. It's a fixed prosthesis. Think about it. So you want to throw away your removable dentures and get a new fixed prosthesis. That's what we call AllonX. I guess the term AllonX just sounds fancy. Everyone says AllonX, AllonX. I guess it's because the word is easy to say, and there's also a mathematical, philosophical concept. What is X? That's right, it's the number of implants. It's a variable in mathematical terms. You know the first order function and the second order function, right? When you call variables, you call them X and Y. So all is how many in total? So, it's about how many implants to use in the bone-anchored concept. The terminology itself, the concept of bone-anchored, is missing. And in orthopedics, dental periimplantitis is called stoma infection. The area connected to the femoral implant is called a stoma, and when inflammation occurs here, it's called a stoma infection. So in the end, it's the same thing. In dentistry, they use the term periimplantitis, and in orthopedics, they use the term stoma infection. Ultimately, the success rate of implant treatment is important. In dental implants, it's also called stoma infection. Periimplantitis is common. That is, to increase the success rate, the occurrence of periimplantitis must be minimized. And to prevent the occurrence of periimplantitis, an implant fixture of appropriate size must be used and implanted in a good location and direction. It is important to use an abutment connection with no or minimal micromovement and to stabilize the occlusion. And it is also important to maintain oral hygiene. Ultimately, the success rate of AllonX treatment depends on the implant that supports the prosthesis. Let's look at an actual clinical case. This is a case where the bone around the implant has been destroyed due to periimplantitis. It's serious. What should I do? In the end, the implant must be removed. Once the fixture surface is exposed and infected, it cannot be restored. In the end, the infected fixture needs to be removed. And here you can see there are several implants. This is a S-lock implant, and then this is an O company implant. This looks like a D company implant to me. This is a S-lock implant. This is a locking taper connection, and this is an implant with a Torx plus connection. The results are good. Why are the results good? Because the abutment connection is fixed by wedging. Micromovement does not occur or is minimal. The reason is simple. The abutment connection of O or D implants is a screw fixation with a Morse taper. Screw fixation is constantly moving. There will be micromovement. So ultimately, the bone around the implant is melting. This is also the case. The bone around the abutment connection is melting. If micromovement occurs in the abutment connection area where the fixture is connected, the surrounding bone is destroyed. Therefore, micromovement occurring in the abutment connection plays a very important role. Therefore, if possible, it is necessary to use a locking taper in the abutment connection to minimize micromovement. Manufacturing SLOC implants with a locking taper abutment connection is very difficult. Obviously, machining implants with high precision is very difficult. Therefore, SLOC implants require 2 to 3 times longer processing time than implants from other companies. Let's look at another case of periimplantitis. This is a Bicon implant, and I think it was implanted about 25 years ago. The follow-up was on April 16, 2021. You can see the left side of the lower jaw. There is bone loss in the second premolar implant. But when I came on May 14, 2024, you can see that the bone here has regenerated again. But the problem is that the bone around the implant in the first molar area has dissolved even more. The bone around the implant in the second molar area has also dissolved a lot. Periimplantitis has occurred. This is a photo from April 16, 2021. If you look at this photo from May 14, 2024, you can see that the bone around the implant in the second premolar area on the left side of the lower jaw has regenerated again, and the bone in the remaining implants has been destroyed even more. Looking at this, in the end, we think the only thing that has changed is the loading condition. Nothing has particularly changed. So, from our perspective, we think the loading condition is the biggest factor in melting the bone. So we removed 2 fixtures. This is a multi-unit abutment that I made 20 years ago. If you look here, it was also used for bridge prosthesis. It has an anti-rotation structure, so it can also be used for single prosthesis. So, there is no abutment that can be used for screw-retained prosthesis for anterior implant treatment right now. Ultimately, if you use an angled multi-unit abutment, it is easy to make anterior implant prosthesis as a screw-retained prosthesis. This way, anterior teeth, or I think multi-unit abutments, have been used for molar implant prosthetics for a long time. However, implant prosthetic restorations have fixing screw holes, and these holes cause a lot of problems. Food gets stuck in them and they cause odors. That's why we put a lot of effort into eliminating the holes or reducing their size. Ultimately, orthopedic implant treatment and dental implant treatment are actually the same concept. The only difference is the size and number. AllonX in dental implant treatment is one-on-one in orthopedic implant treatment. However, the difference is that orthopedic implants are larger than dental implants. If you study with this mindset, it will be a little easier to understand full mouth implant treatment. Subtitle: Otherwise, if you think that AllonX has some mysterious and amazing treatment method, it won't be of much help. Let's continue talking about full mouth implant treatment with the concept of AllonX.